I said to myself when I fell, I'm going to get out of this bed as soon as possible and get back to normal. And about 6 weeks ago, my surgeon said, put away that cane, put away that walker. I have not used them since.
I can tell a difference because I had never, as long as I've had Parkinson's, I have not had therapy such as this. And I can tell a difference.
I really love the care that I get through Amber, and I'm really thankful for the nurse that I have. She does a great job.
Amber Home Care was founded on the belief that everybody deserves the right to live independently in their home for as long as possible. It is our mission to help our patients regain their independence in the comfort of their own homes. Amber Home Care is a locally owned home health care agency. We are Medicare certified providers of in-home rehabilitative therapy and nursing.
Our nurses, we have RNs and LPNs. We are able to do a multitude of services in the home to help patients stay independent. We can take care of helping patients with dressing changes, help you learn how to manage your diabetes, inject your insulin, monitor your diet needs. We can help you learn how to take your medications the way they should be so you can stay safe and healthy as long as possible.
Our therapists and nurses provide hands-on care and communication to our patients as they rehabilitate and return to their routines. Because every patient's needs differ, we provide specialized care on a personal level.
And if it had not been for her, I would be in bad shape right now. But this incident happened to me when I broke my hip, and she came and took care of me. And if it hadn't been for her great and tender care for me, I would have lost my left foot. I have no doubt in my mind about it.
Our goal is always to become obsolete. We want you to become so healthy and independent that you don't need us anymore.
I fell and broke my hip and dislocated my shoulder. And I needed therapy, and I was so delighted to be able to work with Denver and take dance lessons and work all that in with my therapy. It was 3 times a week, and it's been wonderful. One of the best things that's ever happened in my life.
I think the greatest thing about Amber Home Care is that we specifically tailor a rehabilitation program to meet our patients' needs. No matter if a person has broken a hip, or they're recovering from the flu, or say they're just deconditioned from not exercising, I think we can really come in and help people meet their goals.
I have the therapist 3 times a week, which is excellent, in my own apartment, and I'm enjoying every minute of it.
I see a lot of patients that have had a recent fall that may have fractured a wrist or fractured a shoulder and had to have surgery to fix that. Maybe people who have started walking with a walker that haven't ever had to use a walker before, or a cane, use some sort of device to help them get around the home. People with limitations in range of motion, we do a lot of stretching, working with people's hands and arms to help them eat and dress, cook, all the things they need to do.
Well, it's very important at my age especially, and being alone, to be independent. It's helped me do things on my own, and I appreciate it very much.
I'm thinking of a lady who recently came home from a hip surgery, and she was recovering pretty well as far as her muscle strength was coming back and her endurance, but her home just wasn't really conducive to her needs at that time. So I was able to go in there and look at the bathroom and recommend a couple grab bars, an extended tub shower bench, which would help the lady safely get in her tub with minimal assistance. And the person is much safer now, and I have confidence that she'll be unlikely to fall in the future.
If you are currently rehabilitating in a facility or a hospital, tell your social worker, case manager, or discharge planner that Amber Home Care is your preferred provider. If you are currently at home, call an Amber Home Care representative and we will verify your insurance benefits and talk to your physician. Medicare covers 100% of skilled services in your home. You do not need to have a pre-qualifying hospital or skilled nursing facility stay. If you have any questions regarding qualifications or insurance coverage, please contact an Amber Home Care representative today.
I feel secure on my feet. I'm wearing some heels again, and I'm enjoying life very, very much.
They're happy that they're back to a place where they can do what they've used to do. And I've had patients even tell me that they're better and in better shape than they were even before their initial problem that arose to cause them to need therapy.
Out of all my 77 years, I've met a lot of people, but I never met such a jewel as my nurse. And I mean that from my heart.
Whether your goal is to walk again, cook again, or even dance again, Amber Home Care is here to help. Amber Home Care is available 24 hours a day, 7 days a week. For more information, contact us at 614-523-0668 or visit us at amberhomecare.com.